Hello and welcome to Doc Talk Live. Healthy feet and strong ankles are necessary to live an active life, which helps you avoid other health problems. So today we're chatting with an expert on foot and ankle issues. This is Dr. Kevin Miller. He's a podiatrist and a specialist in foot and ankle surgery and joint replacement. Welcome, Dr. Miller.
Hi everyone. Thank you for joining us today in this strange and interesting time in the world. We're all dealing with it in our own way, and one of the ways that I can help is to give you information on how to take care of your feet and your ankles. I know a lot of us are at home with our children or at home from work and trying to figure out ways to stay active, and having good healthy feet and ankles is important. I work as a specialist here at NorthBay Orthopedics. I'm a podiatrist and foot and ankle surgeon. I treat all injuries, diseases, and problems with the foot and ankle. And I'm happy to help and give out information that can hopefully keep you active and keep you from going crazy at home during COVID-19.
Okay. So we're going to go right into some questions, but just a reminder to those of you who are tuning in that if you have a question for Dr. Miller, you just type it in the comments and we'll be able to see it and pass it along and try to get you an answer. So let's talk about just some basic tips on good foot care.
So we all have feet, right? So that's the one common thread with this is you have to get up and move around on your feet. So I always tell people in the morning before you get out of bed, do some ankle circles, kind of move your ankles around like you would do arm circles or wrist circles. That'll help get some blood pumping. If you live in a place where you are worried about things on the floor, I know for instance in my house there's Legos all over the place. I have little boys. We do wear slippers in the house. We don't wear shoes. Look at your feet. Make sure they look the same in the morning as they did at the night before. Obviously clean your feet. When you're in the shower, get in between your toes with your fingers and get soap in there and clean them out. Also, the proper shoe gear is important. I know that goes unsaid a lot of times. People tend to think that they just need to put whatever they want on their feet, but you should wear appropriate shoes that fit you. I always recommend going to a reputable shoe store and getting fitted. There's something called a Brannick device. It's that old sort of metallic cross-looking thing that you'll see people bring out. And if a shoe store brings that out, at least you're going to get the right size shoe. Keeping your feet clean, that can be a lot of different things for you. Obviously, drying in between your toes. I use this all the time with my patients, but people don't do it, and then they come in and I find things in between their toes sometimes, things that nobody should see. But that's part of my job. So take care of your feet. They're important. They'll keep you going in the right direction.
One thing we often hear about is plantar fasciitis. It's on the TV and everything else all the time. So what is it and how do you treat it?
Plantar fasciitis. So let me pull out the old foot model. This is my foot model I've had since med school. So this thing's been through the wars. Plantar fasciitis is an inflammation of the tissue on the bottom of your foot. So it's called fascia. Basically, it equates to like a trampoline for the bottom of your foot. It helps propel us, and it can be irritated. Anything with itis at the end is an inflammation. So plantar fasciitis, plantar is the bottom and the fascia is inflamed. So it can be inflamed for multiple different reasons. There's variables that play into it. It can be from injury. It can be from overuse. It can be from body changes, weight gain, weight loss. We do see lots of things that occur. And so on the foot model, we have the calcaneus, which is this bone right here, the heel bone. And so there's tuberosities on the bottom, which are these sort of areas of bone. And so the medial tuberosity is the most common place. So for those of us that have seen this or treated this or have this, you know that you have pain on the bottom of your heel right in that area. So, it's a chronic problem. It can be acute, but most of the time it's a chronic problem and it comes on for whatever reason. Treatment. So I see this a lot in my practice. This is a big, part of what I do on a daily basis. We do treat things conservatively with this to start. One of the things that we do is physical therapy. We have a great physical therapy department here, and they're very attuned to treating this for me and with what I expect and what we work together to do. Anti-inflammatory medications, if you can take them, are helpful for this. Ice massage, there are some simple things and home remedy type things you can do. You can do topical, any sort of topical anti-inflammatory will work really well for this. Cortisone injections are helpful. That would kind of save that for for things that don't get better with easy treatment. Oral steroid taper sometimes works, and I always tell people that 5% of the patients who have this problem don't get better. Those 5% go on to a surgery, and there's multiple different ways to do it. The most common way is an endoscopic release. We go in with a little camera and cut what's tight. And 1% of those patients don't get better. So, this is a major problem that I see and treat, and I always try to work with the patient for whatever's best for them in order to get them going in the right direction.
Okay. Doc has submitted a question, and thank you for submitting a question. He says, my feet still hurt, burning pain on the soles, even if I use my shoe inserts that I bought from Good Feet. Any suggestions on what I can do?
Well, burning usually constitutes some other issue different than a musculoskeletal problem. Sometimes people have neuropathy, they have nerve issues that can cause burning. Those need to be evaluated in a different way. Inserts are good, but they're not magic. They won't fix a neurologic problem or a nerve issue. That's something that can be easily diagnosed, in the office with simple testing to see if there's, what the reason behind it is. And there are medications to help with some of that burning. A lot of this it depends on your other medical problems too. So, diabetes and vascular disease and some of these other things that can cause neuropathies in the legs and the feet are typically the kind of the source and the culprit for this stuff. So it sounds to me like you need to get evaluated by somewhere else. And I think if you have Doc as your name, maybe you were a Navy corpsman, just like me. So I also go by Doc, which is funny.
Okay. Do I really need the one type of shoe for walking and another for running or other HIIT classes? And what's the difference?
Okay, so I get this question a lot, like, do I need specific shoes for specific activities? And the answer, the simple answer is yes. Not everybody can afford to have a pair of shoes for every different activity, but if you can justify buying a different pair of shoes, say if you're a walker, okay, you're going to do 3 or 4 miles a day, a good comfortable tennis shoe will probably be just as good for you as any other shoe. If you're a climber or a hiker, you should probably have some sort of supportive hiking shoe or hiking boot. And they make all different, there's all different brands. There's Keen and Merrell and all these different things. I'm a big believer in Hoka. I wear Hoka 1-1s, and I'm a runner. I probably put 30 to 50 miles a week on the road in my shoes, and I've been a big fan of those. People come in, I get a lot of weightlifters, CrossFit people come in and they ask me about what shoes should I wear during CrossFit. So if you're doing Olympic weightlifting, you should wear Olympic weightlifting shoes. You're not going to get the same support that you would out of a regular tennis shoe if you're doing those kind of activities. So just be sensible about what you wear and what you can expect to feel like if you wear the wrong shoe. People come to me all the time with pain, and all we do is change your shoes and everything gets better. So it's a lot of it has to do with the finance of shoes, as well as just sort of your own personal choice.
All right, I'm saying hi back to Marilyn, who's saying hi to me. She's involved with the Tennis Challenger every year, so I'm sure she's familiar with foot and ankle issues. Hashim is asking, how do you prevent heel pressure sores and heel ulcers?
That's a great question. So pressure ulcers and pressure sores, you can call them decubitus ulcers, other things like that are caused by pressure. So there is normally some metabolic problem that goes along with it. Poor vascularity to the tissue, some other comorbidities that we see, a lot of peripheral vascular disease, poor nutrition. These are all things that play into pressure sores. Tissue perfuses well in most people. Okay, but if there's a poor circulatory output to that area, the tissue is going to break down, you're going to get these sores. So the main way to prevent it is prevent pressure on those areas. If you are bedridden or you have a family member that's bedridden, you need to turn those patients every couple hours to prevent these bed sores from happening. You can get bed sores on your heels, you can get bed sores on your foot. There's obviously bed sores in other spots of the body that we're concerned about as well, but just offload those areas. If you're at night when you wake up, if you go to sleep and you wake up in the morning, your heels are sore, throw a couple pillars under your feet. Try to get your feet up off the bed a little bit and try that.
Since we're talking about these common foot things, can you talk about bunions? Like, what is a bunion and how do you treat it?
Let's go back to the old foot model. So bunions is sort of a term that we use. It's like a generalized term to discuss and sort of talk about deformity of the big toe joint. However, it can be deformity of the fifth toe joint as well. So the big toe joint itself, we look at the angle between the first and the second metatarsal. So what a bunion is an increase in that angle over time. And that can be for multiple things. It can be, most of the time, it's a genetic predisposition. I always tell patients that someone in your family gave you this gift, and it's the gift that keeps on giving. And so then you have this just like they did. It just changes the angle, and it disrupts the articulation, the way that the joints move, and that causes pain in the joint. It causes cartilage to wear off, and it causes deformity where we start to get, the big toe driving under the second toe. These are treated really in two ways. This is the way I treat them in my practice. We either use orthotics to help support and stabilize the foot so the progression doesn't continue, or I offer surgical correction. There's lots of different ways to fix bunions. There's over 100 different procedures that we use to do it. I'm a surgeon, so I lean towards surgery because I know I can fix things. A lot of people come in with that impression right away, let's go to surgery. Some people are totally adamant against it, so I try to work with them, personally to see what's best for the patient so we can get their bunion to go away, both the big toe bunion and the fifth toe bunion.
We have a question. Do you do manipulation of the feet?
Manipulation, no. I'm not an OMM or a chiropractor. There are certain manipulative things or manipulations that are done in the foot. I've seen them done. I don't know that they actually do much for the foot. There's a cuboid manipulation that I've seen done, which just seemed to cause patients more problems. The last time I saw that one was when I was in my residency, and that's been more than 10 years ago. I don't typically use that as an option for treatment. If people are interested in that, I'll send them to our osteopathic medical providers. We have two of them, Dr. Lim and Dr. Skates, and sometimes they can help with that kind of stuff.
Okay. Any advice on nails that split almost completely to the cuticle?
Nails. So nail is skin, and the skin is our biggest organ, the integumentary system. So your skin, when it dries out, will crack, and any skin will look like that. So your nail is just a different type of collagen, a different type of skin. If you have dry, cracked nails, whether it's fingernails or toenails, I usually will tell patients, okay, we need to figure out how to moisturize your skin better. So essential oils work really well in a nail. Your nail sort of has pores like a golf ball. So if you can get the oil to settle down in there, a lot of times it will soften up that nail and they won't be so brittle and cracking. There is other medical problems. Sometimes it causes brittle, irregular nails, and again, that needs to be evaluated if you're concerned. But try the essential oils, even olive oil, coconut oil, tea tree oil, any sort of oil that you have at home. If you just rub it on the nail, once a day or twice a day, that should help soften things up and they won't be so brittle and cracked for you.
Okay. This person says I have pain in the heels in the morning that comes and goes. It is better during the day. What can I do to prevent it from becoming permanent?
That sounds exactly like plantar fasciitis. That's a very common description of the pain. Pain with first steps out of bed in the morning. People complain of pain after getting out of a car or truck after a long drive, that it gets better as the day goes on. That makes sense because that tissue, when you get up and move around first thing in the morning, there's not a lot of blood there. You're just asleep, your feet were up. So all that blood that has been sort of circulating is now pushed down into that tissue, and it wakes up those nerve endings. So, there are some things to do. You can get up, you can roll your foot over a frozen water bottle. You can take a towel and stretch, kind of wrap it around your toes and stretch your foot so you feel some stretch down in there. And these are all things you could do, at your breakfast table or even before you get out of bed. It just takes time, and then there's other things to do. You can come see one of us, and we'll take care of you, send you to therapy, kind of do all that progression of plantar fasciitis treatment that we do.
Okay. This person's asking about her mom's great toenail. It looks very thick, and underneath looks woody. This morning in the center under her nail, a chunk fell out and looks woody. What could cause this? Is it a fungus? It
sounds like a fungus. So toenail fungus, there's about 3 different phylums of fungus that we see in the actual toenails. Basically what it does is it sort of gets under the nail and into the nail, and it creates this sort of layering of what you're describing, that woody, kind of odorous, yellow to brown tissue, and it really lifts up the nail and kind of creates this layering. I call it it's like phyllo dough. If you ever had baklava before, that's what it sort of looks like I know that's a weird discrepancy and might ruin baklava for a lot of you, but I love baklava, by the way. So that the nail will lift up, and typically when it's that thick, we just trim away what we can, and then we can either start on topical medication. There's lots of topical antifungal medicine you can get at any pharmacy or Rite Aid, CVS, any of those places over the counter. And then there are also oral medications that we use for sort of more advanced cases, as long as the patient can tolerate the medicine.
She's wondering if the nail would need to be removed, or if you can...
I mean, we could trim away the majority of it. I bet you that if there's that much stuff under it, the nail will just get trimmed off all the way back to the base of the nail, and then we can restart and use the medication.
Okay. Do you have any advice on how to prevent foot drop in cerebral palsy patients?
To prevent it? That's a great question. Some of the neuromuscular disease, there's, the stuff that comes with it is we can't prevent. It's going to come either way. There are treatments for it. Now, that depends on the patient and the other medical issues, but I would leave more of that sort of those answers to the neurologists and even some of the neurosurgeons. I mean, I treat the sequela of that. I don't treat the actual reasoning behind it.
Okay. So in prevention of foot and ankle injuries, any stretches and so forth we can do before and after exercise that can help?
So, if you're going to go out for a run, a lot of people just put on their shoes, strap them up, and go out. So I don't ever recommend that, and I'm a big culprit of that myself. I try to, as I get older, I'm trying to stretch more. So I start out with ankle rolls, I call it. I just kind of roll my ankle back and forth a couple times. I always end up doing calf stretches. I've had tight calves my whole life, and so I do wall stretches where I put my feet flat and try to feel kind of a stretch back there in my Achilles tendon region. There are certain foot stretches that are really specific that I don't do, but if that's something that you want to do, try to pick up some marbles with your toes. I know that sounds like a really strange thing to ask, but it will activate intrinsic muscles in your foot. The foot itself has 4 layers of muscle on the bottom. We have intrinsic muscles in between the toes, and we have some muscles on the top of the foot. It's pretty intricate. So to get all those muscles activated takes some work. But a lot of just normal gait will get those things going. But definitely stretch your Achilles tendon, stretch your calf muscles. Work on just getting your ankles loose, and then also hamstrings and quads if you can do that. There are some specific things that you can find. I always tell people, go on the internet, look up stretching, because I can give you pamphlets, but until you actually see it, sometimes there's videos of all this stuff on the web for you to look at and educate yourself with.
Can you explain what the IT band is and how it's connected to the ankle and what to do to keep it strong?
That's a great question. I saw that question on there. I'm not sure that has much to do with the ankle. The iliotibial band is a tissue, and this is more of my orthopedic colleagues deal with this. We have a band of tissue from the hip down towards the knee that sort of connects everything and places a lot of stress or takes a lot of stress off of the knee joint itself. That's an easy stretch or something that you can stretch out as well as get some blood into it with a foam roller. So I'm a big believer in foam rolling the IT band. I do that myself. You kind of lay on your foam roller and just kind of roll over it. I don't know that it has much to do with the ankle. Mm-hmm. I don't treat a lot of iliotibial band tendonitis. I tend to refer that to my orthopedic colleagues.
Okay. So let's talk about everyday footwear. Are flip-flops from the devil? Like, seriously.
I am a wearer of flip-flops, so I will tell you that I won't. They're not from the devil. No, they're actually a functional piece of shoe gear that you can wear as long as it's appropriate for what you're wearing it for. Now, again, are you going to go for a run in your flip-flops? Hopefully not. Are you going to go for a hike in your flip-flops? Hopefully not. This coming from the guy who wore flip-flops on a volcano tour in Hawaii and set his flip-flops on fire. So no, flip-flops are not bad, but you have to wear them sensibly, and you have to be careful with what you're doing with them. And as long as it's a good flip-flop, you can go to Rite Aid and get a $2 pair of flip-flops. They're going to the actual, I don't know what they call it, the little toe part that attaches between your toes, that thing will rip out. If you have a good pair of leather or new material type flip-flops where that thing's not going to come out, I think you're pretty safe. Okay.
What type of shoes do you wear while you're in surgery throughout the day?
I wear Crocs.
Confessions of a podiatrist.
Crocs. I used to wear tennis shoes, but these Crocs are super comfortable. They're squishy. I do, if I'm going to be in surgery for a long period of time, I do wear compression socks. A lot of days I'll have 6 or 7, sometimes 10 cases, and I'm standing up the whole time, obviously. So I'll wear compression socks with these Crocs, and there's nothing wrong with Crocs. If you like them and you can wear them and you don't have any foot deformity that's problematic, wear whatever feels comfortable to you, and these feel comfortable to me.
Great. So how do you determine if a surgery is needed, and typically how long is a recovery after a foot or ankle surgery?
I try to diagnose problems, and I try to give options to the patients. And obviously sometimes surgery is the only option. Sometimes surgery is the last option. So that is a very personal decision between myself and the patient, right? And so I always tell the patient, it's me and you to make this decision, not just me. There are certain times when it's just me, if it's an emergency and I have to try to convince the patient to do what's right because it's going to prevent them from losing a limb or having debilitating injury that's never going to get better. And how long after surgery for you to get better depends on what we do. So if you have a hammer toe surgery done electively, you're going to be better in a couple of weeks. If you have an ankle replacement, it's going to take some time, months. If you have an ankle fusion, it's going to take months. Everything's different. There's this kind of block period of time for any sort of orthopedic or podiatric procedure of 0 to 6 months for you to get better. And so really that's a personal thing too. Some people get better faster. Other people take longer.
Okay. People are loving your Crocs answer, by the way.
Are they? Go Crocs.
What are some effective remedies to keep plantar fasciitis from coming back? Thanks, Eric, for the question.
Thanks, Eric. So plantar fasciitis, I always tell people it's sort of like an undulating wave, right? So you get better, and then something happens and you go south, right? And you get better and you go south. So stretching, icing, proper shoe gear, sort of doing what the physician or the therapist have told you to do if you've already been treated for it. A lot of the patients that have it and get better, I always tell people, if I can get you 75% better with sort of everything that we're doing, then we're winning. You have to do some things at home. So the stretches really, and sort of the home therapy stuff that the therapist will give you to go home with after you get treated formally for it, that's how you prevent it, right? And don't wear poor shoes that may have caused it in the first place. I tell people okay, show me the shoes you have, and they bring in these just trash tennis shoes. I'm like, burn those, okay? So that's how we do that.
Okay. You have a question. What hardware do you specialize in when replacing an ankle joint?
Great answer. So ankle replacements, there are lots of different companies that provide ankle replacement hardware. I have been primarily using Wright Medical. Over the last 3 years that I've been doing the ankle replacements, I guess I'm giving a shout out to Wright Medical right now. The hardware is it's titanium coated, cobalt chrome. 3 different components. We have metal and we have polyethylene. The company that I use has multiple different systems, sort of modular systems, and they're constantly improving their technology. I'm a big fan of the Wright Medical implant. I've had great results. Patients are happy. These are patients who come to me with debilitating end-stage arthritis of their ankle and don't want a fusion. Traditionally fusion has been what we do for bad ankle arthritis, but now we can offer a replacement and give them time and give them ability to continue to walk and do the things they enjoy. Now, you're never going to run a marathon on an ankle replacement, that's for sure. But you'll be able to walk and do the things that you want to do with your family and your friends.
How do you feel about custom orthotics versus, say, the stuff you can buy in the store?
So that's a big difference between anything custom is custom, right? So you're gonna go either to the office and get casted, or go to the orthotist, which is what I do now primarily. I have an orthotist I work with up in Vacaville and here in Fairfield, and they are specially trained to make these custom orthotics. A custom orthotic will control you. Nobody else in the world will be able to wear your orthotic. Versus going to Rite Aid and getting a Dr. Scholl's over the counter. Those are pretty generic. They're really more of a cushion. They're not really an orthotic. Some of the other commercial brands that make these sort of harder orthotics are very expensive. And again, they're just off the shelf. You're not getting sort of the same custom-made device with support and kind of giving you everything that you need to propel yourself that you would with a custom device.
Somebody's asking your favorite surgery, but I think maybe more along the lines of which sort of surgeries do you see that really have great results and bring you a lot of joy in your work?
I enjoy taking care of my active population. So my active people have injuries to ligaments, tendons, and they also have bad arthritis. I mean, sometimes, there are certain procedures that I really do enjoy doing a lot of. Ligament reconstruction of the ankle is really one of my favorite things to do because the patients get better and they're back to activity. Tendon repair, as well as ankle replacement. I do really enjoy doing the ankle replacements. It's been a big part of my practice over the last 3 years because people get better and they're able to make progress and do things that they weren't able to do. And if they're happy, I'm happy. Really, I come to work every day because I enjoy this, and I really like seeing people get better and get back to activity and be able to do what they enjoy.
On a follow-up question on the orthotics, how long do they typically last, the custom ones?
I've seen them last upwards of 20 years. I've had people bring me orthotics from 20, 25 years ago, and they're like, are these okay? And I look at them, I put them in their foot, I make sure that they still fit. I'm like, they're great. You don't need to spend, an extra amount. Sometimes they do break down. It really just depends on how hard you are on them. If you're like an ultra marathon runner and you're wearing them 100 miles, you're definitely gonna get some wear, but they should last anywhere from, I would say, 10 to 15 years if it's a custom molded, sort of harder type orthotic.
Okay. I get big calluses on my feet. Should I shave and cut them down?
Well, again, that is a question dependent on your flexibility and or your other medical problems. If you're a diabetic or have peripheral vascular disease, you should not be anywhere near your feet with anything sharp. Those are easy things that I can help with in the clinic, and I, those are, everybody's like, I'm sorry that I'm here for you to do this, but to me it's prophylactic, right? You come into me, I do the simple thing. I shave off your calluses, I take care of long nails if that's need be to do, and that prevents problems. I've seen plenty of ER visits from people trying to do some self-care at home. You can use Pumice Stone. Pumice Stone is easy, it's not going to cause a problem. When you get out of the shower or the bath, your skin will be nice and soft, and you can kind of go over those areas softly with the Pumice Stone. If you do that consistently, that should help, but sometimes they're too thick and they need a scalpel, and you should not be putting a scalpel near your feet.
Mm-hmm. So in general, how's somebody supposed to know if it's time to come see a specialist like you, or just keep taking those over-the-counter pain meds or whatever?
That's a great question, and again, that's a personal question. Like, some people show up with things where, it's far gone past the point of no return. Don't let it get past the point of no return. If you're concerned about it, come see me. I never say that I never tell a patient, like, you shouldn't have come today. Like, I'm always, I think I have an open ear, and I try to listen, and I try to be empathetic to what's going on. And a lot of times it's very simple for me to take care of the problem and to help things and to help get you back to what you were doing before, or at least comfort you, and that I can treat what your problem is, so that it doesn't get past the point of no return and it turns into a, less of a want and more of a need to be treated.
Okay. Well, we're about out of time, and we want to just take this moment to say thank you again to Dr. Miller for doing this, and that's it.
Thank you.